Now I will be doing palpations at the wrist. Starting on the lateral side, you have your radial styloid process. Going to the middle, you have Lister's tubercle. And on the medial side, you have your ulnar styloid process. Going back to the radial side, here is your anatomical snuff box. The floor of this anatomical snuff box is where you will find your scaphoid. If you palpate in this gap, superior, your anatomical snuff box is your extensor pollicis longus. The inferior one that you see is the extensor pollicis brevis, and hiding right beneath it is your adductor pollicis longus. You can feel two on this side if you push hard enough. Now moving to the lateral side, there is a ball at the bottom of your wrist that is your pisiform. If you palpate distally, you can find the hook of your hamate, which is sensitive to palpate. Between your pisiform and the hook of your hamate runs your ulnar nerve. It is called Guyon's canal. Also on this side, you have your TFCC, which is cartilage and tendons between your ulna and your radius. Running up the medial side of your hand, you have your extensor carpi ulnaris. Now moving into the hand, we're going to palpate the head of the metacarpal bones. So these are the head. This is the head of your fifth metacarpal, running down to the base of your fifth metacarpal, second to the base, third to the base, fourth to the base, and the fifth metacarpal to the base. Then we're going to look at the joints. The joints of your knuckles are your metacarpal joints. This is your first metacarpal joint. And the joints between your fingers are interphalangeal joints. Your thumb has one interphalangeal joint. The rest of your fingers have a proximal interphalangeal joint and a distal interphalangeal joint. Next, moving to the palm of the hand, you have your thenar eminence, which is the thumb side, and then you have your hypothenar eminence, which is the pinky side, and this contains your flexor and adductor digiti minimis. That is the palpations of the wrist.